Hi, Mrs. Reyes. My name is Christine. I'm just gonna wash my hands. Okay, let me go ahead and just close your door for some privacy. All right. How are you feeling today?
Good.
Yeah, okay. Well, can I go ahead and let me do this first? Let me get your full name.
Rebecca Reyes.
Okay, I see that matches here on your wristband and it matches our charts as well. Let me get your date of birth, please.
March 2nd, 2011.
Awesome, March 2nd, 2011. Yep, that matches our bands and our records as well in our system. Okay, Rebecca, do you have any allergies?
No.
No? Okay, good. That also matches what we have on file for you. That is great. So I've reviewed your doctor's orders for today and I am in here to do a quick assessment on you today. Is that all right?
Yes.
Okay, so it won't be anything invasive or painful. It's just going to be a head to toe. I'm going to listen to some of your sounds and things like that, okay?
Okay.
It'll just take a couple of minutes. Won't be very long at all. All right. So, Rebecca, do you know, can you state your full name one more time for me?
Rebecca Reyes.
Perfect. And do you know where you are today?
I'm in the hospital.
Okay, you're in the hospital. Do you know what day of the week it is?
Monday.
Okay, good. And do you know why you're here?
I have a fever.
Oh, you have a fever. Okay, yeah, I saw that. I saw that from earlier. Okay, I'm so sorry to hear that. Well, hopefully we'll get you feeling better, okay?
Okay.
All right, gonna do a couple of quick things with you, okay? I'm just gonna ask you some more questions.
Yeah.
How many fingers am I holding up?
1,
Okay, how many now?
2,
How many now?
3.
Okay, excellent. All right, do me a favor. Would you take one finger of your own and push down on one side of your nose without breathing through your mouth? Take a nice deep breath in. Okay. Okay. Do the same exact thing on the opposite side. Nice deep breath. Close your mouth. Okay. A little congested bilaterally in both nares. I can hear it a tiny bit. Got some congestion in there. Let me have a quick look up that nose. Okay, yeah, little mucus there, I see that. Okay, little mucus congestion bilaterally in both nares. I'm just gonna have a look in your eyes for me. Okay, good. Awesome. Good. Good. Okay, Rebecca, follow the tip of my pen light all the way to your nose. Excellent. Pupils of pearl are bilaterally equal and reactive to light on both sides. Rebecca, I'm gonna say one word very softly in one ear. I want you to tell me if you can hear what I say, okay? Can you repeat what I said?
Dog.
Okay, we're gonna do the same thing in the other ear, okay?
Cat.
Awesome. Okay, really good. Okay, so you heard hearing is appropriate in both ears bilaterally. Patient can see without any problem. She is pearler bilaterally. I am not seeing any obvious signs of distress in my patient at this time. Rebecca, are you having any pain or discomfort today?
No.
No. If 0 was no pain at all, and 10 was the worst pain ever, what would you give me today as a score?
0.
0? Okay, that's really good news. Okay, great. So Rebecca, I'm gonna listen to your lung sounds, okay? All right. Okay, you just stay put. It's okay, you can relax, no worries. Okay, all right. All right, I'm gonna go ahead and listen to lung sounds in 4 spots anteriorly. Here's the first location. Just breathe normal for me. Okay. Here's spot number 2, location 2. Breathe. Good. Okay. Spot number 3. Spot number 4. Okay, great. No adventitious sounds or wheezing are noted in any of the 4 anterior thorax locations. Okay, Rebecca, I'm just gonna have you fold your arm over. I'm gonna listen to your sides, okay? Perfect, that's great. Okay, just here, just there, perfect, okay. I'm gonna go right under here on the side. Just breathe normal. Good, spot number 1. I'm gonna go down a little further. Okay, good. Do the same thing with the other arm for me, please. Just breathe normal. Good. And again. Go ahead. 2. Okay. No adventitious sounds noted on the anterior, on either side, anterior lung sounds in either spot. So that was good. I didn't hear any wheezing. Okay. Rebecca, would you go ahead and let's push this down, and would you sit up for me real quick? That's perfect. This will be really good for my listening to your posterior lung sounds. Okay. Here we go. Okay. Just breathe regular, okay? You can sit up a little more. You don't have to be so hunched there. Good. Okay. I'm gonna lift up your shirt, okay? Good. Good. This is the second spot. Posterior upper. Okay. Go ahead, take a deep breath. Good. Third spot. This is the 4th spot. Breathe. Good. Nice deep breath. Go ahead. Good. Nice deep breath here. Good. Okay. I didn't hear any adventitious sounds on the posterior, for the posterior lung sounds in any of the 6 locations. No audible wheezing or noises were noted. Okay, Rebecca, let's have you lay back down just a little bit. I'm going to listen to your heart, okay? And you can scoot back just a tiny bit if you want. Perfect. Right there is great. Okay. Okay. All right. Okay, let me just get, okay, second intercostal space, right sternal border, aortic, heart rate and rhythm is regular. No extra sounds or murmurs heard. Okay. Second intercostal space. Left sternal border. Pulmonic. Heart rate and rhythm is regular. No abnormal sounds noted. Third intercostal space. This is Erb's point. Heart rate and rhythm is regular. No abnormal sounds noted. This is the left sternal border. This is the fourth intercostal space, left sternal border, tricuspid. Heart rate and rhythm is regular. No abnormal sounds or murmurs noted. And then here, we have right here, you have the left midclavicular line, mitral valve. Heart rate and rhythm is regular. No abnormal sounds noted. I'm going to repeat all sounds with the bell. Okay. Okay. Second intercostal space, right sternal border, aortic. No abnormal sounds or rhythms noted. Second intercostal space, left sternal border, pulmonic. No abnormal sounds or murmurs noted. Third intercostal space, Erb's point. This is the left sternal border. No abnormal sounds or rhythms noted. Fourth intercostal space, left sternal border, tricuspid. No abnormal sounds or rhythms noted. And I'm going to slide over to the left midclavicular line, fifth intercostal space and not lower, mitral valve. No abnormal sounds or rhythms noted. Okay, great. Your heart sounds great. All right, I didn't hear any abnormal rhythms or extra beats or sounds. The auscultation and the was noted loudest at the apex and at the S1, and lowest at the base, the S2. Okay, great. So Rebecca, that was wonderful. You did a really, really nice job. All right, I'm just gonna come on around here, and I am gonna go ahead and I'm going to go ahead and have a look at your abdomen and pelvis. I'm so glad we've had no irregular findings so far on your exam. You're doing a great job. I'm lowering the blanket just a little bit so we can look at your belly, okay? All right, and I'm gonna raise up your shirt a tiny bit, and I'm just gonna pull this down a little bit. And the first thing I want you to do, Rebecca, do me a favor and just bend your knees up a little bit like a triangle. That's great. You can rest them there and you can relax, okay? Rebecca, are you having any abdominal or tummy aches or pains that are bothering you today?
No.
No? Is your belly uncomfortable at all?
No.
No? Feeling okay?
Yeah.
All right, well, what I'm gonna do, I'm just gonna look at it, okay, from this side, and then I'm gonna look at it from this side, and I see that you are even on both sides, and I'm noting no distension. The contouring is nice and smooth and round as expected. Great. And I'm looking at your skin color on your abdomen, and it's a warm olive pink color with no discolorations that I can see. Okay. All right. Very good. I'm going to go ahead and I'm going to listen to your bowel sounds, okay?
Okay.
All right. Okay, here we go. Sorry. Okay. All right, lower left quadrant. Normal active sounds. Left upper quadrant. Normal active bowel sounds. Right upper quadrant. Normal active sounds. and right lower. Hyperactive bowel sounds in the right lower. Okay. And what I'm gonna do is I'm just gonna lightly press on your belly, and it won't hurt at all with my 2 fingers, okay? All right. Not gonna really make you go ticklish, okay? I just wanna make sure that there's nothing going on underneath your belly that I need to know about. Okay. Okay, abdominal area is soft to the touch with no obvious lumps or bumps or distension noted upon palpation. This patient is quite ticklish, and that is okay. All right, Rebecca, I'm gonna cover you back down.
Okay.
I'm just gonna fix your blanket so your belly's not out anymore. You're doing great. Okay, the next thing I'm gonna do, Rebecca, is I'm gonna go ahead and I'm just gonna look at your skin color, okay? I wanna make sure your skin is doing everything the way we want it to. And let's see here. Okay, so we've got warm pink tones, olive tones, or underlying olive tones, and we are warm and dry to the touch. Arms are warm and dry to the touch. Hands are warm and dry to the touch, with no discoloration or obvious wounds or scarring. Okay, excellent. Okay, all right, let's see here. And I'm gonna go ahead and check your, I forgot to ask you, Miss Rebecca, when was your last bowel movement?
Last night.
Last night, oh, okay. I meant to ask you that before and I almost forgot. Okay. Let me check above your knees a little bit if we can. Here, we can pull this up a little. I'll pull these up just a little bit. Okay?
Okay.
All right. See here. Okay, skin is a pink olive color. I don't see any signs of discoloration. Skin is warm and dry throughout, bilaterally. Feet are slightly cooler all the way at the bottom. Perfect. No obvious wounds or anything like that. Excellent. Okay. All right, Rebecca, we're gonna have you, gonna have a look at your pulses, okay? Let me start with your arms and hands, okay? I'm gonna check your radial pulses, okay? There we go. Hang on. Relax, it's okay. Good. Pulses are at 2+ bilaterally. Pulse is strong. Great. Okay, good. Now I'm gonna go ahead cap refill is, let's have a look here. Let me check your capillary refill. Okay, I'm pushing down on the pads of your fingers to check your circulation. Make sure your blood is flowing well. Good. All right, we've got less than 2 seconds to all 10 digits. That is great for cap refill. I'm gonna go ahead and I'm gonna check also your lower extremity pulses in just a minute after we do a couple of things, okay? Okay, let's check your strength in your arms. Rebecca, would you put your arms straight out for me, please? Pronate. I want you to flip them up and supinate. Great. You put them behind your head like this. Good. And just put them back down again. Great. Okay. Flip your palms up for me. Can you push up? Good. Can you push down? Good. Now I would like you to flex your arms in towards you. Bend at your elbows. Good. Flip your palms away like this and then push away. Great. Patient has 5 out of 5 strength to her upper extremities bilaterally, both with passive and also with resistance. So she is doing great. I'm gonna have a look at your pulses down below as well. Check your Dorsal pedals. Great. We've got a 2+. Strong pulse. There, very good. Okay, so the pulses dorsal pedals are 2+, and they are strong bilaterally. Very good. Okay, let's push this down. I'm going to check your musculoskeletal strength. And if you could just sit up just a little for now, okay? All right. Will you lift your legs up just a little bit for me? Now raise them up if you can. Good. Now put them down if you can. Lower your legs a little. Good. Now push against my hands, Rebecca, and lift them up. Excellent. Same thing. Go down and push against my hands through the back here. Good. Can you flex your feet for me? Flex. Good. Push down. Excellent. Okay, wonderful. Scoot forward just a little bit for me to the edge here. I want to check your knees. Okay, raise your legs up again. Good. Down. Okay, can you stand for me? Wonderful. Turn face this way. Okay. Can you lift your leg to the back? Just flex. Let me see here. Just bend your knee. Let me see you bend your knee. Good. Put your knee down. Wonderful. Same thing on the other side. Bend your knee. Great. Put it down. Perfect. Okay, you could turn around and have a seat. Wonderful job. Okay, patient has 5 out of 5 musculoskeletal strength to the lower extremities bilaterally, both passive resistance and against resistance as well. This is great news. Rebecca, you can get comfortable back in your bed again. And I want to also make sure that you are, your circulation is good in your feet. And I'm going to check also and make sure that you don't have any swelling going on. But first I want to check, oh, you've got some pretty polish here. I see that. Okay, so what I'm going to do is I'm going to just go ahead and push on the pads of her toes to check cap refill since she has nail polish. Okay, I'm just pushing lightly there. Okay, great. And the side. Okay, good. Capillary refill is less than 2 seconds to all 10 digits bilaterally. That is great. And I'm just going to go ahead and move your pants up a little bit again. I want to check and make sure that you don't have any swelling, okay? So I'm just going to hold here for about 5 seconds and release. Excellent. I don't see any swelling to the tibial area. That is wonderful. Bilaterally, you have no swelling going on. That is great news. Okay. All right. Rebecca, do you use any special walking devices?
No.
No? Do you use crutches for any injuries?
No.
Or a cane or anything like that?
No.
No? Do you need any of those things up in the future?
Not right now.
No, that's great. So that is great. So you don't need any assistance with your walking, and we're gonna get that report in about your assessment. You did great. Okay, thank you so much. And I'll be back in just a few minutes to check on you, but let's get you comfortable. Okay, and I need to do a couple of things. Okay, I want to make sure that your side rails are up on both sides, and they are locked in on both sides. Perfect. Your bed is in the lowest position, and we make sure that it's in the lowest position for safety purposes. And Rebecca, right here is your call bell. Do you see this device here? See that red button in the middle? If you need me, you just press that button and I'll come and check on you and see what you need, okay? So I'm putting that right here where you can see it. All right, great. Okay, Miss Reyes, well, we'll be back in just a little while to check on you. Do you need anything before I go?
No.
No? Okay, well, I'll be back in just a little while and you rest comfortably, okay?
Okay.
All right.